All right, everyone. We have come to our fireside chat for the day. It is my pleasure to introduce first our moderator for the fireside chat, Dave Wayland. Dave is currently Chief Business Officer at Big 4 Bio and leads international development strategy at Wavemaker 360. His passion for health tech and wellness and their intersection in business makes him perfect to lead this conversation. Dave will be chatting with our fireside speaker, Dr. Nworah Ayogu. He's a board-certified internist. He got his MD and MBA at Harvard. Won't hold that against him. Go UCLA. He was a founding medical director at CityBlock, GM at Amazon Clinic, CMO at Amazon Pharmacy, served on the White House Health Equity Roundtable, and currently is head of health impact at Thrive Capital. Please welcome them both.
Awesome. Thank you so much. Really, really great to be here. I was just talking about the very first Vitals conference. So this is the 11th Vitals conference, and Deb Dab, who was on the recent panel, was my panel guide. So I don't know if you remember that, Deb, but anyways, it's good to come full circle with this, and we're actually coming full circle for the day. So I think if those of you who were here for Jody Lesch's remarks, I think you're going to see some common themes that were mentioned this morning and throughout the day. And so we've done an intro, but I do want to say, in addition to the Harvard piece, you've worked in at least a few countries as well, and maybe we'll come into that as well. But let's kick off a little bit on the career side, and then we'll try to touch on a bunch of things in the time that we've got. And so the other day, you called yourself a physician by background and a builder by trade, which I love. And so tell us a little bit about, tie your career together. What's that journey looked like? And how do you bring the physician piece into that builder piece throughout the past few years?
Yeah, so I'll say, the thing with careers is it's always easier to make the picture kind of looking backwards. I think it's like a constellation. Is that really supposed to be Orion, or is that just a bunch of things that we drew lines between? So this answer will probably change in 10 years. Hopefully it will change in 10 years when I have a whole different set of experiences. But when I look at, my journey and the themes that went throughout, I almost look at, my time as a physician is really the time that set my core and my values, right? The people that I interacted with, the people that I wanted to serve, how I wanted to serve them, and what, and grounded me in my why. And then my time going forward was trying to implement that and build on problems that I saw and gain a broader toolkit in how to solve those. So, you guys are in in business school. A big part of the reason why I went to business school is when I was in med school, I spent a lot of my time sort of doing global health. So, a lot of the great work that we think about organizations like Partners in Health and USAID doing worldwide. My sister works for USAID, or worked for USAID. Do sort of worldwide, right? That was where I was sort of anchored in. And I realized so many of those problems were resource problems. So I went and got my MBA as a resource degree. And then, through the MBA, I realized, okay, there are different ways to think about these problems, which is what led me to CityBlock. CityBlock, capitated payment for high cost, high social need populations. But saying, how can we bring the best of technology, sort of new business models, new operational models to bear for a population that historically doesn't get a ton of sort of innovation, doesn't get a ton of focus. And that was the space in which I learned what it meant to work with product, what it meant to work with operations, what it meant to work with sort of design, and building through startups. So spent a bunch of time in a range of different startups. So that was my first startup, not my last startup, but early stage startups. Went from there to Amazon, where what we were doing was really entrepreneurship. I launched 3 new businesses and, if anything, a new vertical of healthcare within Amazon. So bringing what is a retail / cloud / movie theater / logistics company into healthcare. So entrepreneurship, and now in my role at Thrive, I spend a lot of time with builders, so people who create things, try to create new things, solve problems by creating tangible solutions. Now I work with a lot of builders as they try to build new companies. So far it's been, a clinician who has spent most of his career either building and working alongside other builders.
Yeah, awesome. And just kind of, thinking back, I look at, you're in venture now. We'll talk about that in a moment, but CityBlock, I think, very much sort of an experimental playground for healthcare, in particular with, underserved populations. And then Amazon, certainly a sandbox, a playground for lots of different kinds of businesses. So in some ways, you've been in this venture, at least portfolio management for your entire career. Is that fair?
That's fair. I think it's very different operating because at the end of the day, you are all in on one, right? You're betting on red. You're betting on red 7, period. While obviously in venture, you have a few things that you're sort of responsible for. So there's a delta there, but I think you're right. It's been, at the end of the day, it's the space of folks who are creating kind of new things, and the innovation sort of sphere is not new.
Yeah, got it. And we'll come back to a little bit. You mentioned, I love the, let's ask the question again in 10 years. So we might come back to that one. And as you and I talked about, I think we're both still trying to figure out what we'll be doing in, 5 years, 10 years. You've got some incredibly big roles you've had and you still do. And so before we dig into the tech side, tell us a little bit about just the outside of work. How do you find balance? Because you've got a lot going on.
Yeah, I don't know. I don't know if I find balance.
That's a good answer. That was my answer too. But
I think I know what my priorities are, and I try to make sure that I'm kind of meeting my core responsibilities and my priorities, and then making time for myself. So, I have 2 kids. It's part of why my voice is raspy. My kids brought me home something from daycare last week. And, you can get over the sickness, but then it takes more time for the voice to get over. But I have a 6-month-old and a 2.5-year-old at home. So they are priorities 1 and 2. And that honestly helps keep you grounded when you know what's important, and you have people you can come home to who, could care less what your title is, could care less how your day went. It's about trash trucks. And when it's about trash trucks, it's about trash trucks and Spider-Man. And I honestly find that very, very grounding. Family, friends, and then trying to keep a sense of kind of what you want to do and move forward in the world. But I find that all are useful in their own ways, because when one thing is going right, the other things can be going wrong. If everything's it's rare that everything is going right at the same time, which is, the hard part of life. But it's also very rare that everything's going wrong at the same time, which is also a good part of life. So that is the plus of the portfolio that is the multitudes that we all are. Yeah. It's important to cultivate all those parts.
Absolutely. And I will say, at least for me, while my kids don't understand what I do, even my wife doesn't understand what I do, but the fact that it's healthcare, I feel like at least they get that and they understand the value of what I'm trying to do, what you're trying to do, what those of us in the room are. So I know you weren't here a little bit earlier when we talked through we talked about technology throughout the day. The letters AI were mentioned, more than once today. And
Allen Iverson, yeah.
So let's put AI aside for a second, and technology and technology transformations that you've seen over the past several years. Kind of what's been most exciting to you? Where have you placed bets? And we'll get into that with Thrive in a moment. But just kind of, what do you see as being most important? And then, flip it, what's still underserved where you'd like to be doing more?
Yeah, it's a great question. I think especially with technology and healthcare, we've had a lot of things that were supposed to kind of reinvent everything. I remember when meaningful use first came along and EHRs were supposed to change all of healthcare. Everything was supposed to be easy and scalable and interconnected. And, I think that promise kind of fell flat on its face. I remember, mobile and telemedicine were supposed to kind of be big changes. They were supposed to sort of democratize all of access to care. Kind of those fell flat. So in a lot of ways, I think the promise of pure tech by itself to, reduce disparities, lower cost, increase kind of access, triple, quadruple, quintuple aim, it hasn't worked, right? But I think what we have seen is that, operational innovation mixed with kind of care model innovation, scientific innovation, right? That paired with enabling technology has worked well. I think that's a little bit different in healthcare versus other industries where pure tech has been able to really move the ball forward. I think we found, at least so far in healthcare, that it's been technology plus services, technology plus operations, technology plus science, right? If you look at, companies like Illumina, right? And being able to actually do sequencing at, much, much lower cost. That's the science plus the technology that's been able to sort of move the ball forward. I think we've seen that across the board, that it's been those combinations rather than pure technology, at least in healthcare.
Got it. So in terms of, where you might want to go, and maybe we'll just dig into to the extent you can tell us, what are you looking for? What's that amazing company or amazing set of technologies that you and Thrive are really seeking today?
So we talk a lot about category defining companies. We like to make concentrated bets on, distinctive founders who we think are tackling really hard and important problems. If you look at our portfolio, it's things that we think are truly generation-defining companies and people who are tackling really hard problems. It's why we do, less investments with sort of higher conviction. Within healthcare and sort of going forward, I think we're always looking for people who we think have a very distinctive perspective on the problems of today, as well as distinctive perspectives on how they can be solved. Obviously, we're also, we're fairly bullish on AI, but AI is applied to, specific sectors. I think there's a big debate on where value accrues. We think, there are foundation models that are clearly, distinctive. I think there's a clear leader within the space of AI. There's a reason why when we think of AI, there are companies that are synonymous with AI. What that looks like in the layer in between, the application layer, et cetera, I think that's harder to tell. There were a lot of companies early in the AI journey that their company was in essence, good prompt engineering. And then we see as a new model comes out and obviates the need for their entire company, right? So it's not the space that we want to play in. And I think we've seen that sort of counter thesis has played out. I think for us, what's interesting is seeing how does that overlay with services models, right? What does it look like where for a long time in a lot of industries you saw it was almost the age of the engineer where, if you can program it, you can kind of will it to be and you can create. I think there's an open question of whether this is almost the age of the operator, where now if you have all these kind of amazing tools that can in a way almost commoditize software, commoditize your build, you can now build for what you want. It's having an understanding of the customer, a relationship with the customer, good distribution, sort of good networks and ready access. You can now make all of that much more valuable because you can build customized tooling for your exact use cases very rapidly. And at the end of the day, it doesn't really matter whether or not you have integrated systems throughout because you have multimodal systems that, without an API, it doesn't matter if you have a browser, you have an operator, you have an agent that can then do the integration for you.
Got it. So, so Thrive, you've invested in some, pretty enabling technologies, OpenAI among them, which of course is, very much a foundational tool. You just talked about sort of that user, and so for Thrive, is that physician, payer, patient? Could it be all of those? Who do you see as the ultimate user of maybe that next generation of investments?
Yeah, it depends. I think the role of a lot of these players, I think we're going to see continue to blur, because you have to think about what is your core function when you start to kind of move it to the extreme. So if you're a payer, right, what are your core functions that are core defensible functions? Then you want to go through and see which of those, as you leverage AI, become less important. So which part of your administrative backends, whether that's claims processing, your payment integrity, your call centers, which of these that you used to see as a moat or some type of extreme complexity that you built up over time that would make it harder for someone else to come do, whether that's another incumbent or, a new upstart, which of those is now much easier to build from the ground up and therefore can no longer be thought of as a moat? And what are aspects of activities that someone outside of your box, so someone in the other box, whether that is a vendor, a provider group, a provider system, what are their activities that actually should now move into your purview because you can do it, and vice versa. So I think we're going to see large provider groups starting to take on functions that we used to associate with payers. I think you'll see payers starting to take on functions we used to see with provider groups. We've already seen some of that, but I think if anything, AI is going to accelerate that because it will be that much easier to build the capability.
Would love to see that, and that takes me right to my next question. So you've got I think a super cool title, Head of Healthcare Impact. So, what's impact? How do you define it, and how are you building it, or how are the companies that you're investing in building it?
Yeah, so that's the thing. Part of it is, when you get to choose your own title, you get to decide. You want it ambiguous enough that you can just kind of be whatever you want to be.
You're doing a great job in your role because what is it, right?
No, it's whatever you want it to be. It's like as Taylor Swift said, it's a blank slate. Blank space. I know my team's been. But yeah, so I think for me, impact, there are different ways of thinking about, how you act as a VC. One is see the great ideas that are out there and then invest in the best ones, and absolutely doing that. I want to see all the greatest ideas. And we want to back those great ideas. But there is also something to be said for understanding what direction the world should move to, and then hopefully promoting companies that move the world in that direction. And I think that is also a different kind of impact.
Excellent. And definitely want to talk about the world moving in different directions. And again, Jody Lesh this morning kicked this off really well. The past few weeks have been incredibly challenging, both here in LA and I'm going to say and beyond. And I think the Anderson community, the entire region, is in the early days of what's going to be a long rebuilding process. And we were already in a long rebuilding process economically, but the fires really represent this, what I think of as a multifaceted story that touches on healthcare. It will touch on access and equity, and it certainly touches on building for the future. And so as you put on your VC hat, or could be your physician hat, any of these hats, how do you think about balancing these maybe competing demands of say, innovation, accessibility, affordability?
Yeah, it's a great question. Might even take off both hats and just sit there as a citizen.
As a human, as a citizen, exactly. Love it.
Person in LA, right? This is our neighborhood, our home. It's interesting because we spend a lot of time training in disciplines, and it's a good reminder of why it makes sense to sort of think, interact, and work in an interdisciplinary fashion, right? Why it matters to make sure that whether it's what we train in, but also our friend circles have philosophers and architects and people in sustainability, because it's very easy to take kind of simplistic views to what are actually complex problems. And, it's nice for sound bites to be like, all we had to do was X, why didn't we do Y? But it's much harder to actually dig in and understand, okay, why are these things the way they are? So, this gives us a great opportunity to look at all of the regulations we have around building and understand, why is it so hard to build and build rapidly as we're both rebuilding, but also as we know we have a housing crisis in LA where we need to build more. But the answer is not slashing all regulations. It's understanding the reasons behind why we have some and having a true debate about that. As we're rebuilding homes, what do we need to have? The fire codes that exist now are very different than the fire codes that existed in 1920 when some homes were built. When we rebuild, do we rebuild to new fire code? Do we rebuild to old fire code? Knowing that one is more costly than the other, and one is likely safer than the other, right? These are financial debates. These are sustainability debates. What do we do about some of our environmental laws? I think there are true debates and back and forth. We know we need to rebuild. We need to rebuild quickly. And hopefully we can learn from rebuilding, because not only while we're rebuilding, we also need to continue to build in various parts of LA. We likely need more housing density if we're going to actually house all the people that we need to house. What does this mean for public transportation? Hopefully there are lessons to learn, and there are ways to build back better than we did before while still doing it with sort of speed. But the only ways that we're going to do that is if we can truly actually have hard discussions, and if we can seek to understand and look at problems from multiple vantage points, from sustainability, from the vantage point of a family who just wants to get home and get their lives back in order, right? From the perspective of someone who is not living in the Palisades but is living in another neighborhood and is still having trouble with the same issues. From the perspective of what does this mean for insurance, right? How can we be a model for the rest of the country as they're doing this? Because we know that climate-related disasters are only going to be increasing.
Yeah, absolutely. I think LA, certainly can lead the way there, and this is a great conversation that starts to remind all of us just how interconnected everything is and everyone is. So, we're talking about healthcare, but we're also talking about housing. This morning, Jody was talking about healthcare deserts and access to healthcare in different parts of LA, and you can flip it around. I've had conversations with Cedars-Sinai about how challenging it is for some of their team members, their employees, to live close enough to work, afford to live close enough to work. And so, in a region like Los Angeles, it all really comes together in a major way.
This is clarification, right? Because we don't like to use the S word. We don't like to talk about segregation. But at the end of the day, when you look across our systems in LA, right? Be that housing, be that education, be that healthcare, right? We have a lot of segregation across many axes. We are not economically integrated, and there are costs to that we're not aware of, right? There is a cost to having your firefighters who actually cannot afford to live close to the communities they serve. Same with your teachers, right? These are all people who we we value, right? We hold folks up as heroes. I think we saw the same thing during the pandemic with our sort of nurses. We hold folks up as heroes when we need them. But then what happens a few years later when the acute need is gone, right? Are we still going to sort of support? Are we actually going to dig in and say, what are your true needs and what are things we need to do to rearrange the way that we built our society such that we can serve our needs, right? Like our firefighters are our heroes now, but are they our neighbors? And are we asking ourselves why they aren't?
Yeah, really, really, really good question. And what do you think? What do you think is truly that most overlooked barrier to? We'll go back to healthcare for a second, but just how do we overcome these barriers to achieve equitable healthcare? And that could be from the standpoint of the firefighter, or the nurse, or the team member, or just patients accessing healthcare.
Yeah, I often look at it across layers. Right, I think there is a big role for technology to play in creating a more equitable system. One of my favorite party tricks. You can tell I'm not that fun at parties anymore. So I don't know how many of you guys have played with O1. I used to say new OpenAI model, but it's now the old OpenAI
exactly.
model. All right. Well, how many of you have ever read the New England Journal of Medicine? Okay, a couple more hands. It's surprising. It's not exactly People magazine. But, so in those, they have these case studies, and the case studies are, a case file from the Massachusetts General Hospital case files, and they are the cases that 95 out of 100 doctors can't get right. I've taken to putting them into the O1 model, the off-the-shelf consumer model, every week, and so far it's 6 for 6 in getting the treatment plan and the diagnosis right. So, what does it mean that everyone can have a 95th percentile doctor in their pocket, for about the cost of Netflix, probably cheaper with the way that Netflix keeps increasing prices. So, that's fairly transformative for access to sort of knowledge. I know so many friends who have said, yes, my mother has Alzheimer's. It was really hard to keep track of all of her treatments, what was happening, what I was supposed to do. So I put them in the ChatGPT on a regular basis, and that's what helps me manage it. And that's what helps me know what to say when I'm going to their doctor. So there's actually a big role for technology in democratizing and increasing access. I think there are obviously a lot of policy levers to pull around how we drive equity and how we make sure that our healthcare system actually works well for all of us, right? Be that on how we design insurance, how we reimburse, who we reimburse, how we tie together our programs like Medicaid and Medicare, how we require folks to, see certain folks or not see certain folks. But I think the third level is that we also, there are values conversations that we need to continue to have around healthcare. And those are things on, who gets to make the decision on what we do and don't have, right? Like, what are we willing to sort of sacrifice so that others can have? Which pools are we subsidizing? What populations are we subsidizing? And kind of what does that mean? We don't necessarily talk as much about what are our values, because I often find, we disagree down here at the policy level. And because we have not agreed on our values as a, city, state, country, right? It's very hard for us to get alignment at the policy and operational and delivery levels, because no one has actually had the conversation on the values level. I think if anything, those values conversations and having the ability to actually have them becomes more important in an age of AI, when you have something that can analyze your needs, it can make your strategic decisions, it can make operational decisions, it can execute. It can execute a divine strategy, but the thing it cannot do is define values, right? Values are a thing we have to push in. If you talk to a lot of AI researchers, they call it the alignment problem, right? It's difficult to get kind of AI to align perfectly to our values, because one, we often don't know our values, and we have trouble articulating them and discussing them. And if anything, that is a space that will become more and more important for us as leaders, as citizens, as people in this new world and these new paradigms.
Yeah, very, very well said. And I think that's a perfect opportunity as we look across the room. We have a lot of students here. We have a lot of young entrepreneurs, and so start broadly. Everyone's given advice to our student audience, so you get to be part of that group as well. But what's your advice or guidance, whether it's in getting a healthcare company funded by a venture capital firm, or just picking a path in terms of healthcare or otherwise?
Nice. I'll go 4 pieces of advice, and I'll keep them fairly general. The first is don't trust advice.
Good start.
Right? Because at the end of the day, anyone who's giving you advice is necessarily, giving you advice likely based off of their experience, which is just outdated. Right? Like the world that they've lived in, the experience they've gone through are going to be outdated. So their advice is going to be wrong and is going to be from their perspective. So, take it, but at the end of the day, you should be a sieve and you should take it with many grains of salt. And you should realize it's likely going to be wrong and not, it's not going to be fitted to your situation. It will be it'll be a non-fine-tuned model. So 1, don't trust advice. Take it, but don't trust it. Or just don't trust it fully. Second, don't be afraid to be bad at things. Right? I think, especially when we're early in our career, we're willing to experiment, we're willing to try things, we're willing to sort of be bad at things. I think the farther and farther you get along, the more we expect to be, perfect. We expect to sort of succeed. We need that. And if we're not, we sort of run away from it, which limits our learning. So I think, don't be afraid to be bad at things. I think the third is something that I've actually benefited from. I'm a big fan of the old 90s Marvel cartoons. There's one called the X-Men. I always thought about my favorite X-Men was this character named Rogue. Rogue's superpower was she could take everyone else's superpower. And that is what I've tried to do across my career. When I've run across either really talented, really good leaders or bad leaders, there is always a thing you can learn from them. And being able to learn how to do the thing that the person you're working with does really well should be something you should be very, very deliberate about and you should take out of every stage. Because the ability to continue to sort of compound your learning is something you'll benefit from more than anything else. And then the fourth is surround yourself with really good people and try not to be the smartest person in the room, right? The people that you interact with are the thing that you're going to take with you across all of your journeys. So try to make friends wherever you are because, that's at the end of the day, what you're going to remember is the people who you were on these journeys with, and they're going to be invaluable to you in a way that nothing else will, right? Like the knowledge will become outdated. The knowledge it won't be as important. The knowledge won't be fun. Like it'll move on, right? But like people compound in a way that nothing else does, and that is the point of this whole journey we're on.
Yeah, no, wonderful. And I think the faster paced business gets and the faster paced life gets, it becomes tougher to get to that human piece because we're all trying to close the deal or check off the to-do list or whatever. And it's really important to take that step back and to approach people as people. And the business will follow, the relationships will follow, or the business relationships will follow from those personal relationships. And kind of starting with that is really important.
I mean, you can almost think of you'll hopefully work in many places. Right, like the experiences that are failures are the ones where you bring no one with you, right? So if you leave a job and you're like, oh wow, you're looking back 10 years ago, and you're like, I don't talk to anyone from that stage of my life. Like that was probably a failure, right? Like that's how I would define it. Everywhere else, I'm like, if you could bring at least one person who you're like, I still like that person, I'm still in touch with them, I call them when they need X, Y, and Z, then it was worthwhile.
Yeah, I think that's important. And what I will add to that is. The more time that passes, you will almost always find one of those connections from the past, even if you don't think you have it now. And I constantly find myself going back and, I'm doing business with people from high school and college and business school and everything in between, because ultimately you figure out the shared connections there. And so, I guess speaking of those connections, so I typically open up things saying I'm neither a scientist nor a physician, but I've found ways to work with them and help translate between them and investors, and, attorneys and things like that. You are a physician, and that took you into the world of healthcare. But what's your advice for someone? Advice again. So we can take it with a grain of salt. But somebody not coming from the world of healthcare who's interested in healthcare, what's their next step or possible next steps?
So I always say you want to understand your strength. So, with any job, ideally, you have something that you're bringing to the table, right? This is a thing I'm good at that I can do for this business. Then you have something you're bad at that you can learn. I think of my, out of residency, when I joined CityBlock, I was good clinically. So therefore I could add my clinical knowledge to the workflows we were building, to the patients we were seeing, Didn't know how to build product, but that's okay because, they would teach it to me, right? And like, that's a good balance in a job. When you're educating, you don't have to bring anything because, the whole point is for you to learn. Once you're in the workforce, people expect you to give and deliver while you're also hopefully getting and learning. And like, that's the balance. I'm thinking the same thing for someone who's going into healthcare new, right? Understand your perspective. I'm really good at go-to-market. I understand marketing. I understand PR. I'm a good operator. Understand whatever your vertical is. Make sure you know how you expect to add value. That way, while you're there, I add value here while I learn there. And then the other thing is, at the end of the day, hopefully most of us have some lived experience in healthcare, be that through a family member, a child, et cetera. And then don't be afraid to read. Right? There are a lot of ways to kind of get up to speed on the basics. Everyone likes to say that healthcare is complex, but it's not. Right? Like, we're putting rockets into space. Like, healthcare is not that complex.
Like it. So I've got a couple probably closing things, but would love to hear from the audience. And so any questions out there for Nworah? Please don't be shy. I know this guy's worked in 5 different industries. So.
I'll ask one. Hi, I'm Martina. I'm sort of a budding VC in this diverse LA ecosystem. And I asked this question to a lot of VCs. And you mentioned, part of your role is really looking at the future, where the trends are going, and doing a little bit of that trend prediction to align, your investment thesis with what's being built out there and what's happening in the world. So what I'm seeing a lot in the space, or when the investments are going, are all these, consumer-facing solutions that are separate, right? Our therapeutic area focus, like respiratory health, menstrual health, maternity health, pulmonary diabetes, right? And I'm seeing these solutions come to market and be successful, but I also wonder, is this leading us to a world where, as consumers and those experiencing care, are we going to be living in a world where we're each accessing 50 separate applications to manage our whole person care? So curious about your take on this hot question. Thanks so much for the panel.
Yeah, it's a good question. We tend not to lean into the condition-specific verticals, but that doesn't mean it's not right? Just because it's not our thesis and area doesn't mean it's not what the industry wants and needs. I worry less about sort of fragmentation, because I always say, the solution to sort of fragmentation, individual solutions, is not to not build them, right? If the needs of the customer were being served well, then they would not go to an individual solution. So therefore, the idea that we have a solution that can serve people well, I think, is to be applauded. I'm glad that those are out there. And we should ask ourselves, why are our generous solutions not able to serve that? Maybe it's because Adam Smith is right, and they will always be able to kind of build a specific thing for a specific group better. To me, it's then on the saying that, great, let's build things that can kind of tie that experience together. So I don't think there's anything wrong with them existing. I think the push is on the generalist to build a solution that makes it such that they don't need to exist.
Got it. I will say, just since Martina brought it up, though, respiratory health, there must be some new opportunities for that, in this post-fire world, whether it's air quality monitoring or respiratory health management. So interesting to see.
We learned a lot about indoor air purifiers.
Absolutely.
Hey, how's it going? So with your both your clinical expertise as an MD and then your work in Thrive Capital, I'm sure you're well acquainted with doing a due diligence on the profitability of a business. But I'm curious if you have a process or a framework to thinking about the question of does this business need to exist? Does it add anything to our healthcare ecosystem? Is it kind of advancing the system forward at all?
Yeah. It's always an interesting kind of gestalt, right? There's, this makes money, but does this do good, right? Is this moving the world toward a future that, I want to exist in, that I want to exist? At the end of the day, that's you imposing your values on your decisions, which I would say is a good thing, right? Why would you do a thing that is not aligned with your values? Someone else can go do that. So I would say, I do that frequently. And I think everyone should do that frequently. It's an assessment we should all make, and if we're not making it, we should be asking ourselves why. So to your point, Tom, though, are there set frameworks? Again, I think that's part of why it's helpful that all of us are kind of trained in some type of philosophy or ethics. In med school, we go through bioethics. So we have the 4 pillars of bioethics that, to me, have always stuck with me and I've always sort of brought forward right there. Beneficence, doing good, right? I want to do benefit. Non-malfeasance, people think of that as like, do no harm. And those are different when you kind of dive into them. Autonomy, meaning, you respect the patient's right to make their own decisions, to take on their own risk. The example people often use is, if a homeless person wants to sleep on a train tracks, right, or sleep outside, and it's high risk to them and their health, as long as they are educated and of their right mind, you need to respect the dignity of risk. You need to respect their ability to make their own decision. And then a justice, which is saying you're not just thinking about the benefit to the individual, you also have a responsibility to think about sort of the collective. So those are kind of the four principles, right? No one principle is held up above the others. So therefore, you have to balance between the four principles, but you think through all of those as you're kind of weighing your decisions. I just think it's helpful to be grounded in your own ethical framework as you're doing that, because for the most part, folks are going to impose that on you, right? It's on you to impose that and also to force the question on others.
Excellent.
As a friend of mine always says, there are a lot of ways to make money, so therefore you should make money in the good ways.
Hopefully that's why we're in healthcare, right? Questions out there?
Hello, doctor. I'm Badri. I'm an undergrad at UCLA. So building upon your point about like the barriers in healthcare, so you talked about how like AI is increasing, and it's evident to me that like soon you will be taking AI's like help for like advice, like healthcare advice, like some radiologists are only doing it for some tests. So like my question is like, you talked about values, and I believe that like the main use of ChatGPT or like any of those models is the ability to like customize it. So like, would you envision a model where we can customize the values based on the patient, and then the like model gives like healthcare advice based on that?
Yeah, it's an interesting question. I mean, that is we always talk about personalization as if it's a good thing, right? Because, we all like to be personalized. We like to go on Amazon and it tells me what kind of bike I'll like and the helmet I need and, what kind of movies I like to see. I think we like personalization because it reflects upon us, but there is also a danger and risk there. A good therapist is not the one who tells you exactly what you want to hear, right? When you're like, no one gets me, they're all bad and I'm good. Like that is not a good therapist who just reflects back to you the things you want to hear, right? A good therapist is uncomfortable because they're telling you the things that you need to hear. But there is kind of a balance there, right? On just, what does good is not always what you want to hear. And are we optimizing things for what is good versus what we want to hear? And then who defines what good is, right? And if good is defined by the individual, then we're looping back to it's in essence what you want to hear. But then it's good defined by a group and subset. What is that group and subset? Right? Is that group and subset, your classmates at UCLA? It's just, I think that's the problem is we run this risk of creating these like homogeneous echo chambers. The same risk I think we've seen with social media where there is growth and challenge that comes with diversity, right? And different viewpoints. And as you lose that, it's not good for us as human beings. So I don't know the answer to that, right? Of, you're able to read back and get an answer from your doctor, from your therapist that's personalized to you, or should it be personalized to the objective truth? And if it's the objective truth, how do we determine the objective truth? I don't know. The alignment problem. It's very real. We have not solved it yet.
Interesting. We got time for one more question out there, I think, if there is one.
I'll ask one. I can shout. So it seems like you have a really strong philosophy around morals, values, what is good. Is there something?
Tell them a lot of fun at home.
I understand that.
Talk about the kids again in a moment, but
is that just through the medical training, or was there something or multiple things that kind of reinforce that you really want to double down and having that be like core to how you think about both business and life?
Yeah, honestly, I think I had really strong undergrad mentors. Actually, that's not true. Let's go back farther. I'm gonna, this is how you get in trouble. See, once you got to start crediting people, then you're like, hold on, let me. So yeah, I'm gonna credit my mom and sister with creating my moral foundation. That is the correct answer. But I think, I know,
Awesome.
let's clap for mom. I appreciate that. But I think, I think academically, I had really, really good mentors. I think the global health community kind of thinks about these problems a lot. When everyone asks me, what's a book that was really meaningful to you? I just go through it. I'm like, what if I recently this, this? But it always comes back to, there's this book by Paul Farmer, Pathologies of Power, right? Which to me, that has always been kind of a strong moral framework. Pathologies of Power and also The Lord of the Rings. Like, it's actually same lesson in both. Same lesson in both. But I think it's just early on that you start to develop those frameworks. And then I think part of it is just making sure that you keep people around you who are going to continue to sort of push you on your decisions and what you're doing, right? Like keeping the friends who challenge you, because as you go along, I think you find that people who know you less well will challenge you less often, and they won't challenge you in deep ways, right? Your colleagues oftentimes are meant to keep it professional, which means they're not going to challenge you to your core in the same way that others are. So it's making sure that to me, the foundation came from those early days, but it's maintained by having people around me who will challenge me and making sure you carve out time to have them challenge you. We have a mutual buddy who challenges me a lot and probably challenges you a lot. Really challenges everybody. He likes to keep it real.
All right, Alexa, we'll give you the final question. You've gotten to be up on stage multiple times, so you get the final question as well.
Well, first of all, thank you very much for taking time to speak with us today. From your experience with Amazon, there are two-door decisions and then there are single-door decisions, or two-way, one-way. How do you balance playing around and exploring within the healthcare space and health tech space while understanding there may be one-way decisions, or in other words, decisions that you have to make that you then can't walk back? Yeah,
there's a really good book that I love. It's called, actually, the same author wrote the same two books, so I'll drop his two books. Obviously, Pathologies of Power, best book. If I'm going to run a book, you read that one. But the other one, Alignment Problem by Brian somebody, but he also wrote another book, Algorithms for Life. And he talks a lot about the, explore versus exploit dynamic, right? And how much time you spend in each, when you decide to do one versus the other. And he's got kind of a mathematical framework for how you decide when to do one or the other. At Amazon, obviously, we talked a lot about, there are a lot of sort of core principles and core frameworks, one of which is one-way door, two-way door decisions. The idea is you sprint through two-way door decisions, right? You go through them quickly because at the end of the day, they're reversible. If you made the wrong decision, you can walk through and go the other way. One-way door decisions you need to actually consider carefully. But the thing you realize is actually what's more important is being able to recognize when a decision is two-way versus one-way. And I think the thing that Amazon did really well is because everyone knew of that framework, everyone would be very careful to try to call out what was a one-way door decision and what was a two-way door decision. And you would often, as a leader, you would know, I'm not going to sit here and debate two-way door decisions, just make a decision, do it, we'll see what the result is, make a decision from there. One-way door decisions, the key thing is knowing what's one versus the other, because then once you decide, you can spend your time thinking about the one-way door decisions. I don't know if that answers your question or if it was... Okay.
Yeah, and that takes us to a perfect closing, which is, you mentioned 10 years from now, so we're going to come back to 10 years from now. So the tech side of healthcare, what do you see in 10 years? But I think more importantly, along with that is, what's going to make you most happy in working around that?
That is a great question. I hope we've seen kind of broad adoption of some of these tools in ways that we have not seen other tools adopted. So I feel like I'm hoping AI is kind of broadly prevalent, right? To the fact that knowledge in healthcare is no longer kind of gated, and that sort of AI has solved that problem. I hope that our conversation has been able to kind of move on. We've been able to agree that, we do think that everyone deserves kind of access to healthcare. One of the frameworks that a teacher of mine, gone professor, says he always uses, he would say, look, the one thing we can all agree on in the U.S. is freedom, right? We believe that people should have freedom. It's part of why, we can agree on public education, because we know to access freedom and be a, free populace, we have to have good education. Healthcare, we think, should go in that bucket as well. Because if you don't have access to your health, you cannot participate in this experiment we call democracy. And I think I think at times, yes, that is true, but we have a tenuous relationship with kind of both of those, right? I would hope by then we've at least been able to all agree that, health is a thing we think everyone should have access to. And then from a policy perspective, we have kind of aligned on that as an area. And then all of our debates are more on the actual kind of implementation, right? Should we be, how do we fund it? Who delivers it? Kind of what are the regulations? But we've at least chosen the end goal. I think to me, that would be a good place to be in 10 years.
Okay. And what are you doing that makes you happy there? Still investing, back to operating something? Would you go back to building a company again?
Yes, I mean, you said 10 years. So I have this thing where I tell myself, I like to do a new career every 10 years. So, in 10 years.
You could leave it a little bit open if you want to, but.
It's driving. Every 10 years, I like a new career. So, 10 years as a clinician, 10 years as an operator, 10 years as an investor. In the next 10 years, hopefully 10 years from now, I'm doing something different.
Awesome.
Because, again, you got to do new things. You can be bad at things. You can keep learning. And, I'm too young to stop learning.
Absolutely. Well, hopefully all of us, that's the case. So, Nworah, thank you so much. This is amazing. Thank you, HCA. Wonderful.